Hello, my name is Dax Varnadore, and today I'll be talking to you about the effects of early versus late rehabilitation timing. Research proves that initiating early rehabilitation timing is optimal for the most superior recovery over delayed physical therapy rehabilitation. Nearly 80,000 NCAA athletes undergo orthopedic surgery per year with a sport-related injury. One of the most important aspects following surgery is the rehabilitation process. PT is the cornerstone of post-operative care, promoting neuromuscular control, strength restoration, and return to pre-injury activity levels. The first injury I want to talk about does not require surgery, which are concussions. There was a study done by the Journal of Science and Medicine in Sports, which evaluated 112 athletes who obtained concussions, put them into two groups. One started vestibular rehabilitation 8 to 10 days post-surgery, and one that started 10 plus days, which was the delayed group. The findings showed that the average recovery time for the early group was 26 versus the ones who started rehabilitation later was 31. The researchers then wanted to adjust certain factors of their study to see if the results remain the same or changed. They adjusted factors such as age, sex, migraine history, and concussion history, and still showed that the delayed group rehabilitated 1.39 times longer. Findings do suggest there's a psychology advantage of early targeted vestibular intervention in simulating neuroplasticity. Overall, the research proves that early rehabilitation is the gateway to learning how to treat concussions and evolving treatment methods to make them more effective and lead to the better outcomes. The second injury is a near top 4 humeral fracture, where the humerus is completely dislocated off the bone. Top 4 is showed here. Delays of rehabilitation can lead to limitations in range of motion and functional strength, so rehabilitation time is important for this specific injury. There was a study posted by the Journal of Clinical Medicine that evaluated 84 patients and did their findings at the 12-week mark post-surgery. The early group started 1 week after their surgery, and the delayed group started 3 weeks post-surgery with their rehab. The researchers used 2 major tests to determine the outcomes, which one was the constant Merely score, which is based on a 100-point scale that measures the patient's ability to conduct daily activities, shoulder pain, and range of motion and strength. The second is the DASH score, which measures upper limb disability on a 100-point scale. At the 12-week mark, radiographic follow-up showed no increase in complications with hardware fixation failures or fracture displacements with the early group. As you can tell, both numbers for the early group were better, as well as better shoulder flexion, shoulder abduction, and they conducted less pain over the 12-week mark rehabilitation process. They do suggest that the retrospective design and single cell scope could be limitations. However, the consistency of the data still shows the early rehabilitation leads to more successful, quicker, faster, and overall recoveries without added risk. The data was 95% accurate. The next injury I want to talk to you about is ACLs. As you can see, a completely intact anterior cruciate ligament versus one that is completely torn here. So these patients had to undergo full ACL reconstructions, as I should say athletes. There was a study done, this is a study published by the Journal of Orthopedic Surgery and Research that put the 50 athletes that started rehabilitation 2 weeks, which were the early group, and the second who started rehabilitation at the 4-week mark, which were the delayed group. Medical professionals examine strength, range of motion, balance, functional outcomes, and proprioception, which is the body's ability to sense its position and movement without using sight. Higher IDK scores corresponded with better knee function, less pain, and greater stability for the early group over the delayed group. Higher torque equaled better performance, which allows for an increase in muscular strength. And as you can see, that the other group did obtain better muscular strength over the 12-week period. They also had better balance with their knees that correspond to their whole body. Their return to sport rates were much higher, 78%, and lower joint errors, which leads to better proprioception and improved joint awareness. The study does mention the baseline conditioning and starting rehab too soon may cause discomfort or swelling. However, the results show there's no graft failure. Instability showing early intervention is safe. ACL reconstruction is superior for faster overall recovery. So in conclusion, every one of these injuries, as well as other injuries, do prove that starting rehabilitation earlier than later will get athletes back on the court or field or whatever it is they're doing and they love to get back out there and overall be more successful. Thank you.